Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, I'm 80 years old and in good health. Do I need a living will? By Joe Campbell of Lexington, Kentucky. And here to help us answer that is the newest nurse practitioner at Family Practice, Miss January Hamby. Welcome.
Thanks.
All right. Now, I started the show with saying Medicare Wellness can help you with your advanced directives. Do you address those in Medicare Wellness?
Yes, we do. We actually have a packet that we can go over. We believe it's very important that everyone has a living will or advanced directive. It actually talks about what your wishes are, and you don't want to wait until it's an emergency to have these discussions with your family. We talk about things like if you're unable to speak for yourself, who would you like to make those decisions for you? And it also talks about if your heart, stops, would you want to be hooked up to artificial ventilation, life support, or would you be able to, or be allowed to die a natural death? It doesn't go over dialysis, but that's something you may want to discuss with your physician. Talks about artificial tube feedings if you're unable to eat on your own, would you want that? And goes over more personal, wishes that it would be important for you to discuss with your family.
And as people age, those are kind of things you have to think about. And it's better to think about them when you have your wits about you. You can think and can make decisions and convey those to your family before you're in a life or death situation and nobody has any idea what to do.
Yes, you're correct there.
You can also make the power of attorney decisions. You can guide them in that. And a DNR. Tell us what a DNR is.
That's do not resuscitate. So you wouldn't want any life-sustaining measures. You would want to be able to die a natural death. So if your heart stopped, you wouldn't want chest compressions. You wouldn't want to be shocked. It goes over very specific. It's actually an order that your doctor would write for you if you're an inpatient, but you can also have a written copy of it within your living will or advanced directive of what your wishes are.
So as part of the Medicare Wellness, you talk about these things. If you can't answer the question, you can direct them to somebody who can, and at least get them to think about it.
Yes.
Now, you do some other things in Medicare Wellness, too. Tell me about it.
Yes. We do a lot of the preventative screenings. Lung cancer screenings, there's certain criteria, but if you're a smoker between 55 and 75 or have quit within the last 15 years, Medicare will pay for a low-dose CT scan to rule out lung cancer. We also do screenings for abdominal aortic aneurysms, and men are higher at risk for that if they've been smokers at least 100 cigarettes in their lifetime, or if you have a family history, men or women, of an abdominal aortic aneurysm. And Medicare will cover that.
That's a dilated vein in your or artery in your abdomen that could rupture, and if it does, that's pretty much
fatal, right?
Yeah, quick death. So that ultrasound, which is a sound wave test, simple test, is a screening test paid for by Medicare.
Yes, and if they, once in a lifetime benefit, so if they do find an aneurysm and it's small, then you would have like annual monitoring to see, and if it became large enough, then that's whenever your doctor would talk to you about surgery.
You also talk about bone densities.
Yes, bone densities is very important due to osteoporosis. We start screening women at age 60, and it's recommended every 24 months.
And you can make some diagnosis of osteoporosis and maybe start a medication or at least exercise program to prevent fractures down the line.
Exactly, to prevent fractures. Yes.
Now, also other things, colorectal cancer screening, mammograms, are they part of that?
Yes, they are part of that. Yes, some prostate screenings. Yes, that is part of the preventative screenings that we discussed during the Medicare Wellness.
And you also do some testing, like fall risk, hearing test, is that part? Memory test, too?
Memory test, yes. We check cognition, and if depending on your score, we can make a referral to the memory clinic and get you the specialty care that you may need. Also, fall risk. Falls is a hazard in our older population, and we do a fall risk screening. If you score positive on it, we're able to offer you home health that could come out, do a fall risk assessment in your home safety assessment, maybe get you some equipment that would lessen your risk for falls.
Okay. That's called the TUG test, right?
TUG test. Mm-hmm. Well, that's how one of the things they test. So we test for the fall screen, your fall risk, but there's also questions that we ask too.
Okay. Now, the Medicare Wellness is free.
It is free, yes.
And most of the doctors, think it's a good thing. It's a good screening test to create both a baseline and follow over the years.
Yes.
All right. That's great information. Thanks for coming in.